right, orthopedics versus neurosurgery. Number two, who would win in a fight?
Who would win in a fight? Hands down, definitely Ortho would win in a fight. I mean, if we're talking about a brawl at Buffalo Wild Wings, those guys have the upper hand. But neurosurgeons were a little bit more precise. We would just probably find your C3 vertebra, give you a quick punch there, make you temporarily a quadriplegic, and then we'd probably spend the next 12 hours deciding whether or not we should fuse your spine. Meanwhile, you guys would just be randomly swinging at anything and see if anything sticks, kind of like the way that you took your USMLE.
Neurosurgery has knowledge of the brain, and they would know exactly where to hit you to knock you out. Like they'll hit you in the cerebellum or the brainstem or something like that. So having said that, clearly orthopedics. Who has the harder residency?
Who has the harder residency? All right, listen, orthopedics residency is basically just 5 years of CrossFit with an MD staple to it. You guys literally spend half of your day arguing about protein powder and then spend the other half of the day arguing with anesthesia about whether or not the patient is really out, and then you would spend the rest of the day hammering away at an unconscious patient like a Home Depot employee on commission. Neurosurgery residents, we don't even have time to sleep. We're too busy holding a retractor for 14 hours while our attending will yell at us, and then we sit there and question every single life decision that we've ever made. So yes, orthopedics residency is definitely hard, but only because the things that you lift are heavy, so it kind of makes it hard sometimes.
Orthopedics and neurosurgery both have extremely grueling residencies, but I'm going to give the edge to neurosurgery. To me, if you're able to survive 6 years of the most mundane and boring surgeries, you deserve all the respect in the world. So I'll give that one to neurosurgery.
Winner by unanimous decision!